is Sydney Luong, and this is my directed project, a culturally tailored app-based guidebook for Asian American women managing gestational diabetes mellitus. I'll be going over my introduction. The statement of the problem covers two key issues. One, a high prevalence of GDM in the Asian American community, and two, a lack of culturally tailored material for GDM management. As an example, one study reported that women perceived the information they received from their healthcare professionals to lack cultural relevance and detail. Thus, the objective of this directed project was to create a culturally tailored app-based guide for Asian American women with GDM to improve health equity and GDM. For the literature review, I highlighted 6 main topics that were the supporting literature for the creation of the guidebook. The first topic was the high prevalence in Asian American women, so I included this into the guidebook as it served for relatability and understanding on the guidebook's purpose and goal. The second is a unique risk factors for Asian American women, such as specific genetics, physiology, such as higher fat mass percentage, and biological differences, such as the thrifty phenotype hypothesis. The third, I highlighted the cultural differences, mainly focusing on food preferences. This portion of the literature review highlights the importance of providing culturally tailored advice and understanding, as some may start to restrict all carbohydrates in order to follow standard guidelines. When making the guidebook, I included various staples such as buckwheat, egg, or rice noodles versus pasta, or rice paper rolls versus tortillas or bread. The fourth and fifth topic go hand in hand, where recently it's reported that 90% of women use the internet as their primary source of healthcare guidance. So when developing the guidebook, I also wanted an app capability so it's easier to access and can reach a larger amount of the community. In addition to the app-based goal, it was important that I looked at what was currently available and how it could be improved. There are a few GDM apps out there currently reporting reduced glucose and adverse neonatal outcomes, respectively, for those two apps, but there were not too many that provided a consolidated platform where users can access education, nutrition support like meal plans, calorie AI to help them learn how to portion, glucose monitoring that is automatically sent to their healthcare team, consultations with healthcare professionals. So I wanted to include many of those things into the guidebook in hopes of improving management and outcomes. The last topic was using evidence-based information to help with successful change in habits, because habit formation is the key determinant of behavior change. And one RCT found that self-management and self-efficacy in diabetic patients continued beyond the initial intervention. So in creating the guidebook, I implemented habit building, the transtheoretical model, and self-determination theory in order to have successful outcomes in GDM pregnancy, but even surpassing it to reduce future risks. The educational material was also culturally relevant and used evidence-based information from ADA, A&D, ACOG, CDPH, and so forth. The evaluation tool was made using a 1 to 5 scale rating, where 1 did not meet the requirements and 5 met the requirements, as well as open-ended questions to highlight the strengths and weaknesses of the guidebook itself. The guidebook was sent out to 3 RDN, used the self-determination theory. So relatedness embraces the cultural identity, values, and traditions of Asian American women by featuring a warm welcome message, familiar foods, and acknowledgement of community-specific differences in GDM, fostering a sense of connection and relevance. For competence, I focused on presenting evidence-based facts as well as realistic, attainable goals in a clear, accessible format that empowers women to take charge of their health at any stage. Autonomy, readers were given a flexibility to adapt the information to their individual cultural preferences and personal circumstances. So it fostering a sense of control while having independence in managing their GDM, such as with the physical activity page. With TTM, I included TTM throughout the guidebook in 2 different ways. The first one is through the guidebook flow itself. It begins with pre-contemplation, where individuals may not yet recognize the importance of dietary or management changes. So at this point, the guidebook gently introduces these concepts and supportive resources to spark awareness, such as how does carbs affect my body? In the contemplation stage, participants may consider the benefits of making changes, and the guidebook provides practical tips that inspire, motivate, for that readiness for action, such as simple visuals on what a carbohydrate is. During preparation, participants are planning to implement new strategies, and the guidebook offers more education on reading a nutrition label, symptoms of high versus low blood sugar, what are consistent carbohydrates, and further examples of familiar carbohydrates in appropriate serving sizes, so they're more motivated to move on to their action phase. As they move into their action stage, participants begin actively applying new eating habits and management strategies, while the guidebook highlights tools for meal planning. Once they reach maintenance, the focus shifts to sustaining these new habits through tips on building their habits, adapting their meal plans, and fostering a supportive environment for long-term success. Finally, if relapse occurs, the guidebook would provide motivational prompts that help individuals recognize their triggers, reaffirm their commitment, and guide them back to their respective stage in behavior change process. And then the second way that I incorporated TTM was in the meal plan progression. So I wanted something that was basic to encourage users that it doesn't have to be complicated at first. And then as participants are at the stage of willingness to learn more and prepare for change, they can see more familiar dishes, like things that they would maybe see at a cultural event or a family event. In the action stage, the last one, phase 3, participants are fully comfortable learning more. They're in a routine, and it may be easier to approach more family gatherings or family cooking for them. So recipes are more complex and more typical dishes you may find across all different Asian cultures and cuisines. For the discussion part of the project, overall, the findings were positive and suggest that integrating the SDT and TTM models were effective. For example, the target audience reviewers had a prior GDM diagnosis. Their preference for more detailed content, such as meal planning, risk factors, and glucose monitoring, likely reflect their advanced phase in action versus contemplation when they were initially diagnosed. Additionally, all 7 reviewers reported feeling ready to make healthy changes after reading the guidebook. Future work should focus on technology-driven, behavior-focused strategies to enhance culturally tailored GDM management. Limitations included small sample size, inability to launch a full app, and a lack of outcome testing. I selected these 2 reviewers because their comments about cutting out or limiting carbohydrates were specifically one reviewer mentioned not receiving much information at all, reflect the findings from the literature review where participants reported a lack of cultural relevance and detail that led to unnecessary dietary restrictions, which may suggest that current resources for GDM management are not culturally tailored enough for Asian American women. The implications of the literature review and guidebook feedback reveal a clear gap in care for key demographics affected by GDM, indicating that many individuals may not be receiving the support or education they need for effective management. As technology evolves and grows with the influence of social media, mobile apps may offer a promising avenue for bridging this gap. Overall, this directed project has been insightful. It's been a wonderful opportunity to create a realistic way to improve continuity of care in the Asian American community. And I extend my sincerest gratitude to my family, friends, and colleagues, especially Cohort 11, for their unwavering support throughout my graduate journey. I am deeply appreciative of my chair, Dr. Virginia Gray, and my 2 committee members, Dr. Dustin Moore and Helen Chen, whose guidance made this work possible. For more information, please see the contact information down below. Thank you so much for listening, and I hope this was an insightful directed project.